What's new now? I mean, we've been looking at lung cancer developments for a long time with a lot of patients and a lot of feeling, well, someday something must come out. Now, tell me what's happening that's hot in your area. You're a leader in radiation oncology. What's really gets you going at this meeting?
What's going on, it's, I think, what we call the targeted approach.
Okay.
Targeted approach is not only for drug, it's also for radiation. Targeting, it's in different parts. One is, I'll call the diagnosis, the big improvement in the way we are able to delineate the tumor, the extent of the tumor, to separate what I call normal tissue from tumor. And I think that PET-CT is quite useful to target the radiation. On the radiation, the tools we have today allow us to target really the tumor and not the normal tissue. And so we can increase the dose and have also better results. We may also expect in the future to use a targeting drug to improve the efficacy of our radiation. So we have different areas. And if you think, one example, SBRT, stereotactic body radiotherapy, which is moving from the brain disease to the non-brain disease, has completely changed the outcome of stage 1 lung cancer for patients not candidate for surgery. In the past, most of those patients were sent home by the general practitioner or the chest physician, forget it, there is nothing to do. And if you look today with this kind of treatment, with I call it no morbidity, quoted, you can achieve more than 90% local control with a few sessions, and the patient can still be alive.
And are you seeing more stage 1 patients now? Do you have spiral CT, or where is that all?
Okay, we have two kinds of patients. You have the primary patient without a past history of cancer. And it's clear that with spiral CT we find more small tumor. And on the other side, you have more and more patients surviving the primary cancer, treated with surgery, with chemo, with RAT or multimodal therapy, and coming 3, 4, 5 years later with a second or third lung cancer. And those patients are often very small tumor because they are detected on CT, follow-up CT, and then they are not candidate for an aggressive surgical approach due to poor lung function, and those patients are really very good candidates for what I call local treatment, either SBRT, or you can also think about radiofrequency ablation. But local treatment is possible.
What's leading the radiofrequency field at the moment? HIFU or?
No, it's not HIFU. It's what you call an electrode that you put inside. Okay. Exactly the same approach as for liver mets.
Okay, right. But HIFU is used in liver mets, but not in lung.
A little bit also.
Yes. Okay.
But I have no experience on it.
Okay. We have it in the Institut in Milan, but it's all obviously very early days and it's quite experimental. But it sounds interesting. Where is imaging going to assist radiation planning? It seems to me as a medical oncologist to be most exciting.
There are two different approaches. The classical, I call it stupid approach, sorry to call it this way, it's what we call anatomy.
Yeah.
Usually what we can do in radiation is to do the treatment, the volume we treat according to the anatomical extent. It's clear that with FDG PET, you know where it's tumor and where is no tumor. The future will be to try to move from what I call anatomy to a biological target volume, where you will be able to find where is the hypoxic region, where is a lot of repopulation and so on, so that you can increase the dose where you need it. And that's something which is moving. With the tool of radiation today, inside the target volume, you can distribute the dose and give more dose to some specific area requiring more dose. But that's...
And of course, that also informs your choice of concomitant drugs like vascular targeting agents and so on. I mean, is this one of the ways that you're using?
I think I have some concern with vascular targeting. I would prefer epidermal growth factor because if we look to what happened with vascular targeting agent, it can be a little dangerous because radiation target also the vasculature, and we can have maybe a negative effect. We know already that some targeting agent against epidermal growth factor were quite successful. If you think the story in head and neck cancer with cetuximab, the so-called Bordet trial showing 8 or 9% benefit in local regional control, translating in 8 and 9% survival benefit at 4 years. Those studies are ongoing in lung cancer, but we don't have the result today.
Oh, sure. And of course, one possible problem with a vascular targeting agent is that it creates more hypoxia.
That can be also
exactly what you do not want as a radiation therapist. Yeah.
That's why I would prefer the first generation of drugs.
And what's hot in your institute now? What are you doing with your radiation oncology team?
In lung cancer, basically what we do, it's SBRT for one group of patients, of course. The second thing we try to do is now to try to use FDG PET during the treatment.
Okay.
The third thing we try to do, it's what we call adaptive radiation therapy, which means that we repeat CT during the course of radiation to see if we can reduce what I call the target volume, the field site and the normal tissue. And last but not least, of course, you know it, we try to do combined treatment with chemotherapy or surgery. And one of the big questions for us is the timing of the chemotherapy and the radiotherapy. Should be early or late. What I mean, after 2 cycles or after 4 cycles of chemotherapy.
Are there good models to test this in rodents or whatever? Because you could imagine a whole lot of clinical trials to get this timing, scheduling thing right.
The trouble is that when you try to translate for rodent to human, it can be a problem.
Yeah.
I always remember a story of Kian Ang from Houston telling that the same drug in one model of rodent is radioprotective, and in another model it's radiosensitive. So it's always tricky.
Paul, thank you very much indeed
you're
for
really welcome.
Giving us time, and I really appreciate your good news.